If you suddenly get high fever, chills with shivering, severe headache and body pain, excessive sweating, and even after taking medicines the fever keeps coming back again and again, then do not ignore it at all. Because this may not be a simple viral fever, it can be malaria. Malaria is a serious disease, but if it is diagnosed and treated at the right time, it can be completely cured. In today's video, I will explain malaria symptoms, what the malaria test is, why this test is done, how much it costs, how the sample is taken, and what to do after the report. Everything in very simple and easy language. Hello friends, you are watching Dr. Daljit Official. On this channel, we share correct and trusted information about health, medical tests, and diseases in simple language. If you are watching this channel for the first time, please subscribe so that you keep getting important health information on time. What is malaria? Malaria is an infectious disease that spreads through the bite of a female Anopheles mosquito. When this mosquito bites a person who already has malaria and then bites a healthy person, the malaria parasite enters the blood of that healthy person. These parasites travel through the blood and attack the liver and red blood cells. Because of this, symptoms like high fever, weakness, and other serious problems start appearing. Malaria spreads more during the rainy season because the number of mosquitoes increases during this time. Main symptoms of malaria. Symptoms of malaria can be slightly different in different people, but some common symptoms are seen in most patients. The first and most important symptom is sudden high fever. This fever usually starts with chills and shivering. The patient feels extreme cold and starts shaking, and after some time the body becomes very hot due to high fever. When the fever comes down, there is heavy sweating and the person feels very weak. Other symptoms include headache, body pain, joint pain, nausea or vomiting, loss of appetite, tiredness, dizziness, sometimes loose motions, and darkness in front of the eyes. In severe cases, anemia, jaundice, breathing problems, and even unconsciousness can occur. If fever comes again and again after every 2 to 3 days, the chances of malaria become higher. What is a malaria test? A malaria test is a blood test that checks whether malaria parasites are present in the blood or not. This test also helps to find out the type of malaria, such as Plasmodium vivax or Plasmodium falciparum. Knowing the exact type of malaria is very important because the treatment depends on it. Why is the malaria test necessary? When a person has continuous fever, chills, shivering, and weakness, and the fever does not improve with normal medicines, doctors advise a malaria test. This test is important to confirm the exact cause of fever and to avoid wrong treatment. Many times people think it is viral fever or typhoid and keep taking medicines, which can make malaria more dangerous. That is why timely malaria testing is very important. Types of malaria tests. There are mainly 3 types of tests used to diagnose malaria. The first one is the peripheral blood smear, PBS test, where a blood slide is examined under a microscope to see the malaria parasite. The second is the rapid malaria antigen test, which gives quick results using a card or kit. The third is the PCR test, which is very advanced but usually not done for routine testing. Cost of malaria test. Now let us talk about the cost of a malaria test. Generally, the price of a malaria test ranges from 250 rupees to 550 rupees. The cost depends on the laboratory, city, and type of test. In government hospitals, this test is available at a very low cost or sometimes even free, while in private labs the charges may be slightly higher. How is the sample taken for malaria test? For a malaria test, a blood sample is taken. The sample collection process is very simple and safe. Usually a small amount of blood is taken from the finger or from a vein in the arm. No special preparation or fasting is required for this test. You may feel a slight pinprick while the sample is taken, but it is completely normal. After sample collection, it is sent to the lab for testing. How long does it take to get the report? The report of a rapid malaria test is usually available within 15 to 30 minutes. The blood smear test report may take a few hours or be available on the same day. After getting the report, the doctor decides which medicines are required and for how many days. What to do if the malaria test is positive? If your malaria test comes positive, there is no need to panic. Malaria is a completely curable disease if treated on time. It is very important to complete the full course of medicines prescribed by the doctor. Stopping medicines in between can cause the infection to return and become more serious. Drink plenty of water, take proper rest, and do not take any medicine on your own during fever. How to prevent malaria? To prevent malaria, it is most important to protect yourself from mosquitoes. Do not allow water to collect around your house. Clean coolers and water tanks regularly. Use mosquito nets while sleeping and wear full-sleeve clothes. In the evening and at night, use mosquito repellents, coils, or creams. Clean surroundings and proper hygiene are the easiest ways to prevent malaria. Friends, malaria is a serious but treatable disease. If its symptoms are identified early and proper testing is done on time, serious complications can be avoided. Do not ignore symptoms like high fever, chills, and repeated fever. Get a malaria test done immediately. Remember, the cost of a malaria test is not very high, but it can save your life. If you found this video helpful, please like it and share it with your friends and family so that correct health information reaches more people. For more such health-related videos, subscribe to Dr. Daljit Official and do not forget to press the bell icon. Thank you and stay healthy.